health policy in this country. But as K2's Christine Frizzau reports, nothing ever really changes.
Around the country and in Washington, a show of solidarity, a moment of silence.
In honor of those impacted by the tragic events at Umpqua Community College.
It's a gesture that's become all too familiar, says Pennsylvania Congressman Tim Murphy.
We have a moment of silence on the floor, and then when it comes time for congressional action, there's a lot of talk, a lot of tears, but not a lot of action.
He's become one of the loudest voices in the push to tackle mental health problems in America.
We are at a crisis level of not having enough psychiatric beds. And until we begin to approach mental illness as a brain disease and treat serious mental illness for what it is, we're going to have more bloody summers.
Tackling mental health is, of course, a complex problem. Perhaps that's why so many entities have tried to solve it. But reports show those policies have little accountability, almost no coordination, and lots of government overlap. A Government Accountability Office report found 112 different federal programs spread across 8 agencies, all dealing with mental health issues. How did we get here?
Well, that's a really complicated question.
Dr. Judith Glassgold with the American Psychological Association says it's an issue with decades of neglect, from institutionalizing patients in the 1950s to cutting funding for mental health in the 1980s under President Reagan's administration.
We did move them to community-based treatment, but unfortunately we didn't provide adequate resources to fund those programs.
That means young people who show signs of mental illness are often ignored.
Once those children don't get the services they need, they'll grow up and they'll have problems.
Problems that can affect individuals, their families, and society as a whole. In Washington, I'm Christine Frizzau reporting.